Hello, this is Joe Uhan, and I'm here today to talk about side door strategies to improve functional mobility of the hips. And what I mean by that is, in running, the primary motion that most of us are concerned with for optimal motion is in the side plane, hip flexion, hip extension. And so logically, if we want to improve that, we may do stretches to flex and stretching to extend. But what if in doing that we hit a roadblock? We just aren't getting better anymore. It's very, very stiff, stubborn, painful. A side door strategy represents looking elsewhere into the hip, namely the sides, inside and outside of the hip, to impart a stretching or a mobilizing force that then results in unlocking this motion. And for a lot of us, especially in ultra and trail running, these are the areas that get worked a lot. These are the areas that can get very stiff, and they start to create restrictions in how the hip moves that result in substantial range of motion losses in this plane. And so when we try to do things like stretching into hip flexion, it becomes too restricted. Same thing with hip extension. And so we need to use a side door strategy. So we're going to talk about three things in this video. Number one, why exactly that's important and what we're doing to those muscles. Number two, some pre-tests that you can do, and then post-tests. And then number three, the specific self-mobilization strategies. So number one, let's talk about why we need a side door and why they're so important. So if we zoom into the hip, we've got this ball that goes into the socket. And it's really, if I were to make like the shape of the femur, it's this long bone that has this angle. It has a neck, and then it has a ball that goes into a socket. And that ball and socket is a free moving system. It's a complex moving system. And too often, rather than think of that movement complexity, we tend to oversimplify the hip and think of it as like a simple hinge. So in a simple hinge, for example, if I act out my femur with this foam roller, it may seem like the only movement that the hip does when we run is forward and back. Like it is swinging on this, single dimensional hinge. And so in that paradigm of thought, then all that matters is, okay, if I'm stiff into flexion, well, I must be tight on this side. If I'm stiff into extension, I must be tight on this side. But even though stretching strategies may be effective in proving this, for a lot of us, myself included, we get a roadblock, a point at which I may be stuck and I can't get my hip to extend any farther, or especially me, my hamstrings are so tight, any additional hamstring stretching is just met with more pain and frustration and a lack of improvement. And that's because we're not simple hinges. It's not a two-dimensional, there's a muscle here and a muscle here that have to be stretched. Rather, we have this ball in the socket, and all of these muscles, 17 of them, that are wrapping around that ball and hugging that ball into the socket. And even these little tiny rotators can impart significant forces that if they become too tight, they restrict that big running motion. And so that's why employing a side door strategy, like massaging the muscles that run into the lateral hip or the muscles that run into the medial hip, can have huge gains in range of motion. And so that's what we're going to do. We're going to work on these lateral abductors and rotators and the medial adductors to help free the ball, so to speak, to better move not only in this functional running plane, but in all planes. And so our strategy is going to be using self-massage techniques, using different tools, which I have here. But before we get into that, let's talk about how you can do some self-assessment. So in the article, I talk about self-assessment and some different strategies. Some of them I've covered before in previous articles. but we can do some simple things. The first thing you can do is a simple runner's lunge type of a stretch, whether it's in standing or in kneeling. We can assess hip extension. So you can either get your picture taken or just feel and see, okay, how's my motion in this direction? We can also do something like knee to chest. How high here versus here can you get a thigh to chest? Or doing a straight leg raise hamstring, either free or with a belt. All these are nice strategies. Other things that you can do are a cross-legged stretch, sitting in a chair or on the ground, a butterfly stretch. All of these really interesting metrics that you can do before we do these self-massaging techniques. So especially if something is that you know is really asymmetrical, really stiff on one side, test that thing. And then also pay attention to where you feel a restriction. Say if I'm really stiff here and I push that down, where am I feeling the restriction? Is it on the inside or sometimes it's on the outside? Maybe I feel that in my glute on the right side that's keeping me elevated here. So try some pre-tests, then do some of the mobilization strategies, and then do a post-test. So on to the mobilization strategies. You want to use some sort of tool because the muscles that we're working on are both really deep and they're stubborn. And sometimes there are these thick, ropey, short muscles that oftentimes our fingers can't get in, or even like a foam roller, it's just too big. The force isn't focused enough to get after some of those deep rotators that I talk about in my other video. So we want to use something a little bit more targeted, and I'd like to use balls. Now, there's lots of specific massage mobilization quality tools out there. That's great, you're free to use those. But most of us probably have some sort of sporting goods balls around, ranging in density and in size. So I've got all sorts of tools here, ranging from tennis balls, double tennis ball, baseball, lacrosse ball, and softball. I like the variety of density and size. And so what we're going to start on first is the lateral hip. I'm going to start with a softball for me because this area is rather big, and I like to start general, and then maybe I'll work into a smaller, deeper area with the lacrosse ball. But our strategy for the lateral pelvis is to work in a horseshoe. And so if I come a little bit closer, what I mean by that is the lacrosse ball is going to denote the location of the greater trochanter. That is the side handle of the femur. Around that trochanter is where most of the glute muscles of the lateral pelvis attach. And so if this is my bony attachment point, you're going to see muscle fibers come down here. They're going to come in front, and they're going to flow in all directions into this point. Now, I don't want to massage directly onto this point. That's going to be painful. But I can do this horseshoe pattern to the front, above, and behind that greater trochanter. I can do that against the wall, or I can do it on the floor. So let me show you some strategies on the wall. So maybe I'm just going to explore. Maybe I felt something in one of my pre-tests, a stiff area. Either way, you're going to take a ball against a wall, and you're going to apply pressure. I am unweighting my massage leg while leaning against the wall. And you can see I'm doing a couple different strategies. This up and down strategy is going with the grain of my glutes. I can also do a side to side strategy. That's sort of a cross grain massage technique. Or I can just sit and do a prolonged pressure, or I can add motion, a little bit of a rotation to that leg, which is going to expose different fibers of that muscle. So if I was on the imaginary wall, here's my glass wall facing you guys, here's the top of the horseshoe, the front, and the back. And that area that I'm working is going to be what encompasses the pelvis. Below that pelvic rim is where all those glutes attach, and that is all fair game for massage and for potential trigger points or stiff areas. So working around that. One special area that we want to consider is the posterior pelvis. In my other video, I showed these deep rotators deep below the glute max and the glute med. These little rotators come in and they attach on the backside of that trochanter. Those rotators, the ligaments, those need to have some motion and can get really tight. And we can get after them if we have a smaller, more dense ball. And so what I like to teach is we find that greater trochanter again and I come back into the dimple. Now, once I'm there, I can do a couple different things. I can go back against the wall, and that's okay, but I have a lot of success with tilting you guys down. I have a lot of success getting onto the ground and laying flat and just getting that ball into the trough. So I'll show this technique. Here's my side view. I'm getting on that ball. Trochanter here, I roll underneath it. I'm gonna roll maybe a 30-degree angle on top of that ball. I'm still mostly flat, but now the ball is in the trough behind that trochanter. And so now I'm gonna roll up and down. And if that bone were a clock, and say I'm on my left hip and that clock is facing up, I'm mostly at the 9 o'clock position right now, but I can roll down to like 7 o'clock, almost 6 o'clock. There's not much at 6 o'clock, that's mostly just more bone. But I can get those rotators at 7 o'clock, 8 o'clock, 9 o'clock, then I can come up, get towards 10 and 11 o'clock, but that's gonna get out of that joint trough, so to speak. So we'll go back at 9 o'clock, and I can again just do prolonged pressure here, or if you can see my foot wiggling a little bit under the chair there, I can do some rotation. But that is an outstanding spot. And compared to rolling on a foam roller, it's much more targeted, much deeper into that area. So those are primarily the strategies of the lateral hip. Another possible area for the lateral hip is the anterior. The big culprit for the anterior aspect of the lateral hip is a muscle called the tensor fasciae latae muscle. That muscle is helpful but pesky. It is supposed to help us with flexion and abduction of the hip. It also is a big stabilizer. It runs and connects the IT band down to the knee, but if it gets too stiff, it too can suck the ball into the socket. And so getting maybe a bigger ball, but maybe a softer one, onto the anterior hip, either against the wall or potentially on the ground in the front, but again, sort of off to the side. That is our strategy for getting the anterior lateral hip. The key for any of these positions, however, is to be able to relax. So laying on here, letting that muscle go, letting it sink in, then adding motion. So that is the lateral pelvis and hip. The medial pelvis and hip, the adductors, the groin muscles, are also really important. The adductors are all of these muscles that connect the pelvis to the medial thigh. They are super important stabilizers, but they also can get overused in the running stride. They can help with flexion, they can help with extension, and with ultra and trail running, they can get overused. And if they get too tight, they suck that femur into the pelvis too tight and can restrict that normal cardinal motion of the stride. So we work those primarily with a foam roller. It's still a pretty big group. Some massage ball can be effective here, but I'm going to show you guys foam roller. And so we're going to take a full-length foam roller. We're going to have it parallel to our body. So if I'm on the ground here, I'm going to have the roller here. I'm going to have my leg out at 90 degrees. So in this position, I'm putting that group on a little bit of tension. It feels like a thick rope. And then what I'm going to do is roll side to side as my primary mobilizing force. Then I can add some different motions. I can do rotation, I can do flexion and extension, or I can do flexion and extension through my body on the roll. Front view. Again, roll is parallel to my body, my leg is side to side. That's my mobilizing. Primary mobilizing force is running the length of the adductors. There are other tools and rolls out there that have additional contours. Those can be especially effective at really targeting that adductor group. That is a great strategy for adductors. And so what you can do, you add these techniques. You spend anywhere from a couple minutes. Sometimes that's all it takes is a minute or two to make a big difference. Retest some of your motions, and especially for something like this, for example, if you know you have something like this motion tight, both adductor and posterior hip can make a huge difference at taking a hip that's stiff in this direction and dropping it down. But I think what most of you who are characteristically stiff will notice is a substantial improvement in the running plane, in your ability to get full extension and full flexion. And ultimately, that's why we're here. We're runners, we want to run fast, we want to run far. That requires really good hip motion. And so try these techniques. Try this side door work. Try it for a week, a few minutes a night, working lateral hip, medial hip. Then try your other classic stretches again. And what I think you'll find is you're going to get more results from those stretches, and you're going to finally get the range of motion results that you've always wanted. Good luck.